Okay, it's 1 o'clock. We'll go ahead and get started. First of all, I want to take this opportunity before we get into the agenda to thank you, everybody that has served on the Finance Committee since I've been here. Some of you have been on it since day one, and this is my last official meeting, I guess, for this committee. I'll still be coming to the meetings. I just won't be in charge of them. You'll have somebody better, so everything will be fine. And I also wanted to just welcome two guests today, or two unfamiliar faces, I guess. If you want to just introduce yourself and just kind of...
Ryan Winger, lifelong St. Joe resident. I recently threw my name in the hat for the open school board position and talked to Dr. Edgar, and he asked that I would come over and feel stuff out.
Yeah, I invited him to the meeting today because we had a really good discussion, and I deliver meals with his dad on the south end, and so I thought it'd be a good opportunity for him to be here. And then Tammy, you want to introduce yourself?
Sure. I'm Tammy Smith-Hinchy. I will be the new coordinator for health services for the district. And so they've asked me to come to the meeting today for some discussion afterwards, I think. So.
Nice to meet you.
Nice to meet you.
Thank you, guys.
So is that good place for you?
Yes.
Great. Well, welcome.
Thank you.
Okay, so we'll get right into the agenda. The first thing on the agenda is Carden Park Clinic 2223. Let me just give you some, the documents that I will be referring to will say at the top, school year cost 21-22, 22-23, and then also have Carden Park and patients seen. And then I'll have Tammy assist if you guys have any questions in regard to this. Let me give some brief background on what the Carden Park Clinic is. The Carden Park Clinic is a place where we see patients throughout the day. It was a clinic that was funded by Mosaic. We had a partnership with Mosaic that went away in 2018-19. So in the first year we funded that locally. And then fortunately the last 2 years we've been able to fund it with ESSER dollars. And so this year we're back to the point where we can apply for the ESSER dollars for this portion of it. We have built it into the 22-23 budget, so it's something that is budgeted. We feel like it's very beneficial to not only our students but also for our families in that area. One thing that we are talking about is we would really like to expand this program into other parts of the community. It's very needed down around, on the south side. We felt like the problem with Hosea is that it's busting at the seams anyway, so we really don't have a facility down there right now, but it is something that we could take a look at, possibly at Hyde in the future. This is not for 22-23, I'm just kind of planting the seed. And then also Lindbergh is another good spot, and we actually have a portion of the backside of Lindbergh. I don't know if you've ever been in there, but it actually would turn into a clinic very easily. So we would like to expand these services into the future, but I just kind of wanted to give you some brief background of where we were at. So what I did is I asked Dr. Downing to put together some information so you guys could see what we had spent in 2022 or 21-22, what she has budgeted in 22-23. You can see there's a small raise there for the nurse, billing, coding. She had to pay an additional $22 an hour. And then the other big thing is payroll taxes. She estimated those in 21-22, and next year they're going to go up. So I feel like this is fair. It does not seem like it's, as prices go up with everything that we do right now, I felt like this was a very fair comparison. And then on the second sheet, she had mentioned how many patients we saw the month of August, September, October, November, December, January. You can see that was a big month for us. One thing that we have asked her, Tammy and I and Maria met with her last week, and right now we feel like they're there at inopportune times, and so we've asked them to be there during lunch. That's something that right now they're leaving about 11:30, not coming back until 1 or 1:30, so we're missing some people there. Talked to her about flexing some hours on certain days, coming in maybe at 6:30 one morning, staying at 5 one evening, and they're going to work with us on that. There is one other thing that I requested. It was kind of a one-page document. I'll send that to the Finance Committee whenever I receive it. I just wanted the Board of Education to be able to see what they actually do. And I said, just put it all on one page, tell me what you do. We did not receive that yet. We were supposed to receive it this morning, but the nurse practitioner who works has resigned from the position, and so it's kind of up in the air with how we're going to move forward there. But we're pretty confident that Sybil's going to go ahead and put that in. Go ahead, Tammy.
I can kind of speak to what they do.
Okay, yeah, if you would, that'd be good.
I've been the nurse there at that school for the last 5 years, and that clinic, when utilized correctly and with the right way, is very, very good for the community. Access to care is Buchanan County's, there's 3 top things, and it's mental health, access to care, and obesity for our school-age children. And so just having that clinic there allows patients and families that do not have cars, that have to take the bus, and it's a long trek clear out to Lakeside Pediatrics. So if we're able to provide the care for them there, parents can walk up, they're able to get their child's care right there. And so we've caught appendicitis. Just they come into the nurse's office, they're complaining of something. I, as the nurse, or my co-nurse would pick up on something, and we would get them right into the clinic. And before, we've had a kid with appendicitis that we got from our clinic out to the operating room within like 3 hours. And that avoids people having to utilize the emergency room. I think it's a very beneficial thing for our schools, and like Gabe said, bringing it out into the other areas of the community where there's just a lack of care and opportunity for these families that really need it is just a plus. And it keeps our kids in school. If someone has a sore throat and a slight temperature, we can get them checked right then and there. The parents can come up, they can see the nurse practitioner, she can check for strep. If there's no strep, they can go back to class. So it helps us to keep our kids in the building, getting their education, and it's just a great asset to our community as well.
And as you know, we struggle with attendance anyway, and what would happen before, if we didn't have this clinic, the parents would pick them up at 9 o'clock and just never bring them back.
Yeah.
So they would be missing that entire day, so that's very beneficial for us.
Two quick questions. We
Yeah.
have nursing in other schools, just not a clinic, right?
Right.
Every
This
school.
is an actual doctor's office.
Okay.
It's
Second-
small, but they can do anything that a doctor's office can.
And is there any pay for any of these services by the patient? Is there any?
Yes, there is, they utilize insurance and Medicaid.
And you guys are able to take that and,
The clinic through Downing Pediatrics is able to do that.
okay.
They are working on getting some services to help with patients that don't have any insurance. So they're working on getting some services to kind of help pay for things before they're able to get their Medicaid. So they're working on some help for that.
Question.
So when the partnership went away with Mosaic in 1819, we had to go out and find somebody, and Downing Pediatrics is who well, she actually had come to us.
Yeah.
So she's kind of our third party.
And so is there a revenue side of this thing too then?
Not for the school district in itself.
Question. Unless you have one.
No, I'm good.
So say you have a school like Carden Park that has a clinic, and a kid doesn't really get sick, but maybe they have a headache, something that if they got sent to the nurse's office, they would handle. Would they go to the clinic or?
No,
is it
just to the nurse's office.
Okay, so there's still a separate
Yes.
nurse's office
Yes.
other than the clinic.
And anybody in the school district can go to that clinic. So if there's a high schooler at Lafayette that needs a sports physical today, we'll try to get them into the clinic so if they can't get into their physician, to get that done so they can go to basketball practice. So there's lots of things that the clinic can do to help. They can see any student within the school district and any staff member within the school district. So during COVID, when we were doing test to stay, we would, any kid from the school district could come there early in the morning to get their COVID test, find out they were negative, and then go on to class.
Gotcha.
That was
So-
really helpful during that time.
So can a kid come to the clinic without, obviously a parent or any of the medical, payment insurance information that the parent might provide?
Not necessarily. They do well child checks, and so we'll send out paperwork come with families, and if families fill out well child checks and send that back to the clinic, they can pull students out of class for a well child check without a parent. But if it's a sick visit, the parent does need to be there.
Gotcha.
And if they don't have insurance, they're working with a third party to help families get that insurance. But I'm hoping that we'll get another social worker over there at Carden Park that can also help families with that.
Well, Gabe, I love this program, by the way, but it seems to me like, gosh, I hate the burden. I don't mean that burden because it's doing the right thing, but burden the school district with that. It seems
Yeah.
to me like it's an overlap with Payton Park Free Clinic or some other funding mechanism that could help pay for the, if there's not revenue to cover the expenses, it's too bad that the school district's having to just pick up that. I love that we're doing it, don't get me wrong, please don't misunderstand that, but just a question.
Yeah, I understand. I mean, and like I said, we were fortunate enough the last couple of years where it had qualified for ESSER funds, and there was just not anything available. The only dollars we had available were strictly tied to learning loss, and it just didn't qualify for a learning loss.
Are there other schools across the state doing something like this?
Yes. They have school-based clinics in Cape Girardeau, in Joplin. There's probably more. I know there's some in St. Louis too.
All similar arrangements where, because I get the schools paying for the building, paying for the office basically, but we're still paying for that. I guess I'm a little confused. So the doctors being able to bill insurance, Medicare, Medicaid, et cetera, and get that in to help cover.
The cost of supplies and the nurse. I mean, we're paying out some, but those questions the doctor would probably be able to answer better than I can, just as I'm starting this role.
I am certain it is not a money-making
No,
venture.
it's definitely not.
By any stretch of the imagination to have a single office that way, and just even just the mix is probably not a great mix of folks, probably some uninsured, et cetera. So I get it. I agree with Tom. I think it's a great plan. It's just a matter of where do you want to spend it. You get teachers, you get all sorts of things.
I do think that it can save money for the school district in the long run, as far as keeping kids in class, keeping staff in their buildings, making sure that, people have what they need immediately, rather than being out for 3 days because they can't get into their doctor and things like that. So there's that retroactive way of helping with costs.
I think it's a great benefit. Just some tough decisions, right?
There's so many things to follow up on, but one possibility would be to say, what does happen with the insurance reimbursement part of that? I mean, where does that go? If it doesn't come to offset these expenses, where is it going? That might be worth understanding.
Okay.
So you agree with that?
I'm assuming Mosaic got out of it for a reason, because it wasn't much fun.
Well, there was a lot of partnerships that we had with Mosaic whenever they went through some rough times there. And so that wasn't the only thing we lost. We lost fourth grade challenge. We lost, there was a couple other things. And they're actually bringing back some of that stuff. And so this very well could be worth a conversation moving forward with new leadership at Mosaic. Those conversations will take place to see if that's something that right guys think.
Well, I know something like the fourth grade challenge is coming back.
It is, yes.
It is.
I think it's a modified thing. I think Mosaic is, I'm trying to anticipate, I don't know about the appetite for the clinic.
Right.
As its current state is financially, but look, every comment I've made, I want it to be positive. That's what I mean, Tammy.
No, I understand where you're coming from.
Yeah.
And I do think that it could be lucrative if we could get it built up the right way.
It'd just be.
And with the
it's-
right person in
It's
there.
so right to
I'm
the
just
thing
gonna
to do.
It's the right place to be offering it, that's for certain.
Any other questions? Yes, Mr. Reader.
Just a couple of clarification on it. When we started talking about this subject, we were talking about Lemberg as a possible second location or something like this?
And, you know, if we were gonna grow it, I would feel like Lindbergh is definitely a possibility. The backside of the school is actually built into a clinic.
It wasn't planning.
Okay.
It wasn't planning initially, yeah.
So, and that's great. That particularly right in the part of the need, just like Garden Park is. So right now, who's funding it, or how did it get there, and what's it costing us as a district?
ESSER is funding it right now.
Right, the money we received over this
Yeah.
period because of the pandemic. Okay.
The first year after the partnership with Mosaic, we paid for it. School district funded it. The second year, ESSER funded it. Third year, ESSER funded it. This year, we're requesting to go back to local funded because we don't have ESSER dollars to spend on it. And the approximate amount of money is $316,000.
316, you keep that just as it is?
Yes. That would be just for Garden Park in itself.
Okay. So, can we expect that if we did go ahead and expand to Lindbergh, it'd be about double that amount?
Probably more than that, because Lindbergh, the need probably is just as great or greater.
And then I'm sure there'd be an initial cost to get it going.
And that was the great thing, and Mosaic gave us all that. You know, everything that they had, they graciously donated to us, so we started from, I mean, we had what we needed to get going.
Yeah.
So definitely there would be some expenses there.
When we come to the time, I think we could approach Mosaic for that, to help with the startup.
Sorry, okay.
Between the stuff that they remodeled.
Yeah.
So that's a topic of discussion for 23, and we talked about it, and we really want to see if there's a way we can expand into different parts of the community. But just like the questions we're receiving, I mean, it's not fiscally responsible on our part to go funding $1.2 million worth of services.
I know, but I'm looking at it like on the other end of it, I have a program of kids who have used Cardin's Clinic a whole lot. I mean, I was able to get a lot of our kids, I was able to get a lot of the older kids into the clinic as well. And so, I mean, I know off of a personal level how like extremely valuable it is, you know, to the kids, even if it's not like a moneymaker or
Right.
even if it's a loss. On the other side, it's not really a loss.
Yeah.
It definitely adds value.
Yeah, and I appreciate that. And you know, the Board of Education, I tell them this all the time. I mean, you have to prioritize what you need at that time. And if they feel like that's a priority, then they go with it. But, you know, they're going to have 14 or 15 priorities, and they're probably only going to be able to afford 5 or 6. But this is very valuable, I think, and it's proved itself.
Yeah, still, well, so, only $316,000 in a $146 million budget. I mean, we stood it up the first year, that they paid for it the last couple of years. I mean, right now, are we deciding not to do it at all, or we're deciding to do it for one more year, or what?
Yeah, we just do 1 year at a time, and the board will vote next Monday night to.
To do this, continue or not?
Yeah.
Okay. Because I just see this kind of, it's so important. This is as important to those communities, and it needs to be expanded for sure. And let's stand it up for one more year at our cost. But my gosh, if this in this community within a year, we can't get the other people out here that support it and contribute to it, or figure out by that time how to get continued grants or get continued funding from somebody to stand these two things up. And I'd say in a few more years do another one, because this is as important as security, because it's as important as security. It's hard to be more important than security, but this may be more important because it helps the attendance. It helps the attendance, which is one of our high priorities. One of our big failures right now is attendance. And if this in any way helps doing that, and I just think it reflects good. Again, I'm not known for wanting to spend money, but by gosh, I'm going to vote all the way. I think we should even, for only less than $1 million, stand it up this one year. We go out and challenge the community, and next year we stand it up with contributions to open another one in Lindbergh and to fund for here to eternity. Because it's so important because of our high poverty rate in this town. It's so important to save people from financial ruin every day, even in a small way. It makes the kids healthier, it makes our community healthy. So that's my 2 cents worth. So good. I'm glad we haven't voted on it, and can we get on the thing to double it?
Thank you for your comments. Any other questions or comments?
Is there any financial benefit in maybe contacting Northwest Health Services for like a South End location, or?
We did have conversations with Northwest Health, and this was in 1819 at the end, so we haven't had any conversations with them since, but they were not interested at that time. But it's definitely worth the conversation, and we're going to get out there and try to figure something out.
I guess my main reasoning for the questioning is because we're a little cramped for space right now in some schools, so
Oh, yeah,
we don't have the
yeah.
offering. So is that something maybe we contract with that third party and use their brick and mortar?
Use their facility.
establish- Yeah.
That's a good point.
But isn't the point of having a school locations because they can't get to a medical clinic, and if Northwest facility is a medical clinic, why would we fund them?
Which I don't have the
Just
answer here.
asking,
No,
I'm
that's a
sorry.
great question.
I think, back to your comment about Katie Hall, they don't currently have a pediatric clinic. They see mostly adults,
Okay,
and so that's part of the issue.
I think that's a really good answer on that. I mean,
So-
one is, we know Peggy Hall does an important thing,
They do.
and this does too. And we know that it takes some separate outside funding to continue to support Peggy Hall. But I just think, as the finance committee,
No, I get
the
it.
due diligence of the finance committee should be, we understand the revenue and the expenses side of the thing.
Yeah.
And we're not saying don't have it, we're just saying we should understand what's the flow of, if there's reimbursement dollars coming in, we should understand what part of the cost is it offsetting. It might be able to allow us to do something faster somewhere else if we knew that information.
I can bring that up.
That's just a financial.
Yep.
Well, just a good point, Tom, because as we know, just recently, the new person that's coming down at Mosaic, he's already stepped up to the plate in a big way to help the school district. So, I mean, gosh dang, $316,000, what kind of better, I mean, so there should be somebody who wants to jump on this, I would think. But these numbers here, right, say it right there. Well, we haven't even got questions.
Okay, thank you. Second item on the agenda is the 22-23 budget. We're going to ask Katie Nye to kind of go through the 22-23 budget with you. It's in pretty good shape, and one thing we want you to understand is that this is preliminary. Obviously we're guessing to prepare this, not guessing, but we're using numbers from the Department of Elementary and Secondary Education that might not be as firm. And what we will do is we'll make sure that we bring back to you the real budget in September once we have, obviously payroll is our biggest concern. So once we run payroll for the month of September, we can better understand exactly where we're at. But we feel like this is conservative, and I'll kind of turn it over to Katie and let her do her deal.
So, you should have two attachments. You should have one that's like has the numbers and there's a budget message. The budget message is just more detail on how the budget was built, some of the numbers that go into that. So we'll just look at the one that's titled fiscal year 22-23 across the top. line out what the FY '21 actual was and what our current year budget is, and then where we expect next year to be. And then we added a column to show you without ESSER, because ESSER 3 is $23 million budgeted in here, and so it kind of overinflates it just a little bit. Give you some more real numbers. The salaries and benefits were built using a 1.36% increase that the Board of Education approved earlier in the year. Salaries also increased from the prior year due to the ESSER 3 positions, which would be the social workers and attendance interventionists. Purchase services have increased due to transportation costs, along with the district increasing the field trip allotment for kindergarten, 3rd, 1st, and 5th grade. We used to allow them $9 per pupil, now it's up to $15 per pupil. Supplies have also increased significantly due to fuel prices and our utilities, specifically natural gas and electric. And then capital outlay was the largest increase, and that was $18 million for the ESSER 3 funds to upgrade the Hvac system with the 3rd phase of the Schneider Electric. And the long and short-term debt increased from FY '22 because we have a $5.6 million prepayment on our 2013 bond. Anybody have any questions?
So if you notice out to the right with the ESSER 3, if you take those numbers back and compare to FY '22 budget, that's a little more real just because we're backing that ESSER out. That total number, if you look at the total number budget, which some of the people like to talk, well, you have a $145 million budget. Well, this one's built at $168 million, but it's not real because, so it really is 145. You're right, you said 146 minutes ago.
With our revenues, local taxes were calculated using the January assessment letter, which is $1.168 billion. We left the current tax rate at $4.3744, which will be updated in August at the end of the month. An average collection is 98%, which is the first year we've calculated it using 98%. Usually we're a little bit more conservative with 95, but it's stayed steady at 98 for the last 3 years. Our state revenue, DESE has allowed us to use the weighted average daily attendance from prior to COVID, so we're using the FY '20 weighted average daily attendance, which is going to allow the district to avoid an approximate $5.1 million decrease in state revenue. And then our federal funding increased by $23 million because of ESSER 3.
So, let me ask you about, can I ask a question yet?
Yeah.
So what about the funding with the busing? You mentioned that there with Apple. Is that a fixed contract or is that a variable?
It is fixed with a certain percentage increase over each year, if I'm correct. I think it was 4.9%, and then we just added a 50% increase on fuel.
And so we're not getting any kind of surcharge for fuel pricing or anything like that?
We actually pay the fuel. It's not part of the contract.
Okay, thank you.
So, so the bottom is revenue, the
Yes.
top is expenditures. And if you look at the grand total at the bottom, say FY '22, for example, it says 144 million. But if you subtract the 137 million, then that's the extra money that we would
Surplus.
have to work with. So instead of always, if we just say we got a $144 million budget, I think it'd be more accurate to say the money we got left over after spending money on benefits, salaries, supplies, materials, etc.
And the next page kind of lists out more of a detail, and it'll show you what the surplus is expected to be for next year. Right now, and again, like Dr. Edgar said, this is still pretty preliminary. It's going to be about a $900,000 surplus for next year, and I would say a large part of that is because for the first time in, I don't know, however many years,
Bruce might know, but it's been a long time. Transportation.
yes,
When Bruce was a superintendent.
the state's going to fully fund the transportation grant in a very, very long time, which is, we're expecting, I'd say, 2.5 million compared to roughly 800,000 in past years. So that is going to contribute to the largest reason for the surplus.
What was it beginning of
The
reading?
trend.
So what the transportation grant would normally be, we're estimating 2.5 million, but normally it's about 800,000.
And that's why the $900,000 surplus is there.
It's all transportation driven.
Yeah.
Yeah.
The state has fully reimbursed for transportation at 100% for forever, and they won't after this year. Most likely, this will be a one-year deal. It looks like they'll go back to what they have been probably.
So which is also one of the things that I think we should keep in mind, because we get all this ESSER money and we budget, you know, expenses that are recurring, but it's just a spike and then a drop off, but we still have.
That's why we tried to, on that first page, that's why we tried to back that out so you can see a little bit better. And it still showed that you're going to have a pretty good deficit, but your operating fund is really what you want to pay attention to. So your operating fund, you're going to spend 134, 131. The revenue side is 135, so you have a little bit of a surplus. Whenever you put capital projects and you put debt service in there, it kind of convolutes it a little bit. Sometimes people will think, oh no, you know. So from a total budget standpoint, we are going to deficit spend a little bit, but from operating is what we need to be paying attention to, and that's what I pay attention to every day.
So FY23, let's see. Yeah, so there's some deficit spending there.
Total budget-wise, yes.
With 160, and we're spending 168. So.
But you can see none of our funds are actually going to end in a deficit. So even 3 and 4 won't end in a deficit.
Yeah.
So with the ESSER dollars, Fund 4 is really where it's skewing some of the numbers. Because you might not be expending those, you have them, you're not expending them in this year, and so it's.
Are valuations fixed already, right, for this budget year?
No.
That you're planning?
We'll get a letter January or July 1st.
Okay.
And that's when we'll build the tax rate on.
Did they, I know one of the big things, at least one of the things I felt personally, personal property taxes on vehicles, because vehicles went up so high, and I know they were looking at some sort of cap or adjustment on that, so I don't know how big of effect that is, but.
There was legislation for that. It would not have affected us here in St. Joseph, just for the fact that our assessed valuation does not go up 5%, but they were going to put it was 5%. They were going to put a 5% cap on it, and as far as I know, they did not cap that.
So we're pretty.
More revenue, it won't affect your tax, because it's personal property.
Right. So we're pretty comfortable on our budget estimate still being very conservative.
Yeah, and what would we build this one at? 1%. And it's been over 2% the last couple of years. I would anticipate it's going to be something similar to that. I'd tell you one thing that has really, and I was a little bit nervous, or she was a little bit nervous, I guess, to do the collection rate at 98%, but I want it to be real as possible. You know, I don't want to sit back here and build balances and do all that stuff, and people come back to me when you presented a $3 million deficit and you have a $5 million surplus. But the collection rate has been high, and higher during COVID than ever.
Yeah.
That's bizarre. But that's a good thing for Buchanan County.
You know, the other blessing that you said quickly was the fact that the state's going to continue to reimburse based on attendance before COVID. You know, do we see that shoe dropping? I mean, if we do, we need to be thinking about next year. That's going to be a big drop in state funding.
That's something that we actually just had this discussion at lunch, and that's something we'll have to pay special attention to, and it's something we'll probably report back to you guys every month, just for the fact that it is a $5.1 million deficit if that happens. But every school north of I-70 has declined in enrollment, so are they going to let that many schools, are they going to let every school north of I-70 fail? So legislation will be something to definitely watch in regards to that.
Just a comment, thank you.
Yeah, no, yeah, we just had that conversation 45 minutes ago.
Everyone's hoping 22, 23 rounds.
Yeah.
Yeah, that's the other piece, is hopefully the attendance starts to come back a little bit better too. But we know ours is going to be down, because we lost the students.
The last thing I'll mention is the fund balance is estimated to be 23.71, which there is a board policy that states the board would like to be 20% or above. So we're still going to be well above that, be in pretty good shape.
I didn't catch that.
The board policy states that the fund balance needs to be 20% or above.
Yeah,
So we'll be at 23.71. That's our estimated.
yeah.
And if your assessed valuation goes up 2%, then that's gonna, that's gonna grow, that balance is gonna go. I would anticipate it'll be closer to 26, just like what, at the end of the day, not to put any pressure on these two, but,
Well, you also have to remember, it's a bigger denominator with that 168.
you get to use the 168. I
That
guess.
168 makes a little difference there too.
So is this 20%, did you say it was a board policy, or is that like a, okay.
Yeah, they actually put that in place when I got here. The fund balances were about 15. And to be honest with you, if our fund balances are not over 13, and you couldn't make payroll in the months of November and December, your tax dollars start filtering in January, February. So they were getting close to the point where they're going to have to borrow money in order to make payroll. And so that's why the Board of Education chose to go that direction.
Absolutely.
So it's a local requirement.
Yes.
But it becomes a state requirement when you get below 13.
Well, it doesn't become a state requirement. It just becomes you can't borrow money from payroll.
I see.
There are financially stressed school districts, but I think that's less than 3, right? So. Any other?
Yeah, well, and then that'd be just one thing here. I was hoping this is good news somehow, we're gonna have a little extra money. Because the long-term and short-term debt, 14 million, 27, and I saw it go down to 5, and then goes kind of back up to 8, 9, that's still significant, less than 14. Does that mean we're gonna have some extra money there?
It does not, because Fund 3 in itself, it just funds itself. Okay, so it pays for the debt that you have. So it works just like this. It works in a circle. It does not get outside of that. We can put revenue into Fund 3, but you can't take revenue out of Fund 3. Now, we do make some prepayments and those types of things to put the school district into the applications in place. But as far as having more dollars to spend, that will not be the case.
Because they went from 14 million down to the 5 million, then there wasn't any extra money there. The debt service was just smaller that year or
Yes.
something? So we retired some debt?
Retired some debt.
Okay, good, that's why I was hoping.
We had a refi in there too, didn't we? We had a refinance in there as well.
Yes, we used one of the bonds to
Okay,
refinance our new 2020. The district's debt stands at 30.9 million, but that's well below the legal limit of Missouri. So 15% of your assessed valuation, which is 175 million. So we're
So-
well below that limit.
What was that again? The
The
30.9?
debt limit for the state of Missouri is 15% of your assessed valuation. So our assessed valuation, 15% would be 175 million, and currently for 2023, it would be 30.9. So we're well below that.
right, so that's what we get in that catch-22, if we wanted to build 2 new high schools at the same time. But if this debt was paid off as 30 million, then you'd have $175 million at least to work with, right? And I think it seems like we could get 2 schools.
Not at least, that'd be most that you could.
Well, right, okay.
Yeah.
We have no debt at that time, and.
So that's where the number comes from. Whenever Larry had, whenever we had talked about this before, you have to subtract that 30 million from the 175.
Right.
Our bonding capacity was 141.
Right.
We went down to 136 just to be safe. I'm sure it has grown a little bit, our bonding capacity. I'm sure that our no tax increase bond issue has grown a little bit, but I would hate to price out a school right now, just for the fact that I'm sure, I don't know that it would be double, but there's a lot of school districts that passed bond issues the last time around. They were facing some serious, what we just talked about, one on the bus barn, it was twice as high. So it's a real small school, but if they were gonna build a new bus barn for $400,000, their prices come in at $800,000. And they had priced that before, they ran it. So it's crazy out there.
Your interest is a little bit than that too.
And I don't want anybody to do, I was thinking at least a decade down the road for new schools.
Okay.
At least a decade. Because there's a lot of extra money there in a decade.
Any other questions? Okay, thank you. Third item on the agenda is architectural interviews. Just wanted you guys to know that the RFQs were due for architectural services. This is, if you remember, we went with the CMAR at risk route. We chose to come off of that route. We only had one bidder. We did have 2 architectural firms in the state, or in St. Joseph, Creel, Clark, and Seifert, and also Ellison Oxshire. They both have worked for the school district in the past. I think they're both very capable of doing the project. We will be interviewing those 2 companies at 3 o'clock and 4 o'clock next Monday. So if you guys are interested in sitting in on those interviews, it will be an open meeting, and you're sure welcome to come as a finance committee representative. And it's not really about dollars and cents, it's just about partnership. That's kind of what we're looking for. I'm developing the questions this afternoon. I'll send you guys a list of the questions that will be going out to them. Since they both are local companies, I'm going to provide them with the questions as well. This is not a catch me, catch you. You know, I'm not out to get anybody. I want everybody to have a fair opportunity. And and both these companies know that. I've talked to Jeff Ellison, and I'm sorry, I can't remember who I talked to at Creel Clark, but they both know that it is coming.
And is this for this isn't specifically for a project, though?
Yeah, it's for Hilliard, the 15,000
Okay.
square foot addition to Hilliard.
Yeah, thanks. I couldn't remember that.
Oh, it's 20,000 square foot.
Actually, I think it's 25 now.
25.
It is
25 negotiate
25.
down to 20.
And but only 5 of it now is shell building. 20 of it's going to be totally tricked out. Several companies in town have already pitched in.
So,
This 15,000 square feet could possibly make us the biggest trade school in the area.
Yeah, I mean, I think there's a lot of really good momentum right now with Hilliard Tech School in itself. We are really creating some really strong partnerships with a lot of those businesses that need Hilliard right now, to be honest with you. Alltech being one of them. We've had great conversations with them. We've had great conversations with Gray Manufacturing. We've had great conversations with Herzog and Hilliard. I mean, I don't want to leave anybody out, but we're in the process of creating an advisory council where they can have people from their companies serve on this board that will help us, you know, as we grow Hilliard, we want to make sure that we're buying the right equipment. We want to make sure we're buying the equipment that Alltech's using. We're buying the equipment that Herzog's using, buying the welders that Gray Manufacturing are using. There's no reason for us to go out and just buy stuff, and it's not going to be a seamless transition to the workforce. And so we feel like we have a really good thing going there, and I'm excited about the opportunity.
I want HTC to become the MIT of the Midwestern trade schools. Hilliard Technical Center, the MIT of the Midwest.
Any questions in regards to that?
will there be an opportunity to ask questions? Like,
To them?
yeah, at the meeting?
I'm going to send a list of questions to you guys.
Okay.
If you want to add one, add it, and I'll add it to it.
Okay.
But sure, there will be a question and answer period at the end. I think we allotted 10 minutes or something. So, yeah, so yes. Okay, the last thing on the agenda, levy rollout. I'm sure this is the most anticipated thing that's on the agenda for today. Just kind of wanted to let you know where we're at. Mr. Foster can chime in if he wants to talk about a couple of meetings that have taken place. We intentionally tried to roll this out with 6 weeks to go, and that was kind of what we thought, the time that we needed. We have went to a couple of meetings so far, just because they didn't have meetings between now and August 2nd. We wanted to make sure we got in front of those. So I have spoke at one. I spoke at 2040 this morning. And I know, David, if you want to go ahead and tell them which ones you spoke at. And that was just really in general. And we talked about 61-cent levy. We talked about everything that the Finance Committee has approved to this point. I've shared a document with you today. We'll go down through here. And if there's any changes you want to make, Katie has this saved. We'll make those changes. And I'll take it to the Board of Education on Monday, 27th. So, David, do you want to talk about where you have been? Or?
Yeah, just 2 places so far, Chamber of Commerce Diplomats Club and Lions Club at the Benton Club. I think that was last week. So probably 20 or 30 more to go. And if anyone wants to help out, definitely willing to throw you on the list. And we got, I'm on the campaign side, so obviously we have yard signs and palm cards coming soon. And some of those will be this week.
Thank you. And what I did is in 2019, we were invited to go to a certain amount of organizations. So I just had Cassie send an invitation or send an email to every one of those people that we spoke to the last time, gave them an opportunity to ask us to come. So they're rolling in right now. It is a document that is shared with the Board of Education, so they know exactly where we're at. Probably from the administrative side, it'll be myself and Dr. McGinnis. And then from the Board of Education side, it'll be David and then whichever other board members want to participate if they have ties to the group. So that's kind of the plan for it. But we try to make sure that it's not too many people so we have a consistent message. I'm meeting with my administrators on Thursday to roll out that consistent message with them. So if you want to, let's shift to the one-page document. As you know, in 2019, we rolled out a one-page document, and I'm happy to say that we have put a check mark by all of that stuff to this point. We still actually are working on, we're in progress at Lafayette and in progress at Benton on the security entrances, but as soon as those are complete, everything would have been checked. So I think this was pretty self-explanatory. There's 2 things I believe that people are really talking about, and one of those being attract and retain teachers, and the other one is providing supports. So as we go down through this, I kind of want you just to put that in the back of your mind and think about the communication that we're sending. So on attract and retain staff members, salary and benefits, step and lane movement for all employees. You'll notice that we built in step and lane for years 1 through 6. So the entire 6 years of the sunset, everybody's going to get their step and lane. We have built in raises for an increase to base salary in year 1, year 2, and year 3. Last time we did not build in raises because you never know about what the state of the state is going to be from a funding standpoint. The only reason I built in 3 years is because we do have a healthy fund balance, and I felt like it's probably something that the teachers deserve, the staff members deserve. So hesitantly, I built in all 3 years. Last time we just put in 1 year because we knew in 23, 24 that we were going to be okay. Hiring an additional staff members, approximately 6 to 9 each year for classroom size reduction and supports. One issue that we're facing, or one of the biggest concerns, and the Board of Education has talked about this, and I'm sure it'll be talked about at our retreat on the 8th, is that discipline is something we have to get under control in the school district. I firmly believe this. I tell people all the time that I don't think people are getting out of education because they're only making $38,000 base salary. I think they're getting out of education because they're thrown into classrooms where there's not enough supports to support them to do their job. And so I really think that we need to focus on that moving forward, how we can become creative, how we can think outside of the box to provide these types of supports. I know we're talking about volunteers, we're talking about mentor programs. We have to get people from the outside to come in and help us. There's no secret that the school district struggles with those types of things, but we can't fix this on our own. So we're asking everybody in the community to step forward and help us with that. So we have built that in there. So we did not just put teachers, we did not just put supports, we just put 6 to 9 staff members, because if we expand early learning, then obviously you're going to have some early learning teachers you're going to have to plug in there. If we want additional paraeducators, which we can't find right now, we still have 17 to hire, then we can plug those in there. If we have 31 kids at Lindbergh and Carter Park in the 5th grade, and we don't want those class sizes that large, we just plug another 5th grade teacher in there. So that's what that has been built in for. Building expansion and improvements, the HVAC upgrades. As you all know, you had served on the finance committee. The prices did kind of get out of whack with the Snyder Electric contract, and so we still have about $9 million worth of work to do. So I have built that in over a 6-year period. We'll let Larry and Bruce decide how that's going to be paid off. We need to put it up front. We need to do the work, but we'll pay for it over the 6 years so we can kind of spread it out. But they'll use their expertise on how to go about that. Operational costs. One thing I do want to make note, if you notice 150,000, 100,000, 100,000, this is well beyond what we already have in place. So what we do, we have been fortunate enough the last 4 years, or I guess last 3 years, and we will be fortunate enough come June 30th, that we make a maximum allowable transfer from Fund 1, which is our operating levy, to Fund 4, which is our capital expenditures, levy. So we make that transfer. So that all goes toward capital improvement. So it all goes towards the stuff we're talking about down here with operational costs. This is above and beyond. So the 150,000 above and beyond, 100,000 above and beyond. One thing that I would really like to focus on is sidewalks. We have a real issue here in St. Joseph with sidewalks, as you guys know. If you go up to Pershing, you go to Pickett, there's no sidewalks. And so we have began those conversations with the city of St. Joseph and myself, and we're kind of talking about that. But if there's something we can do on our property, that's why those dollars are being built in there. You know, public safety, and so sidewalks is going to be a focus with that extra dollars. And then as you can see down at the bottom, at 61 cents, it generates $6.9 million, and it shows down at the bottom how we're spending those dollars added up. So I think this is pretty self-explanatory. I think it shows that we're really asking for things that we're doing right now. We're asking for operational dollars. And I think it will, you know, if we come through with this, I think it's, I mean, it's a good document to show, and it's a good document for proof. Any questions in regards to that? Yes, Larry.
I don't have a question, I just make a comment that you probably all are realizing this, but this is a continuation of an existing levy. It's not an increase in what you're presently paying. So that may get confused by some the minds of some of the voters, so it's be real important to emphasize that, I think.
Can you define staff when you said staff and teachers? Who would staff be?
All staff.
Like administration down, all staff?
Yep.
What are we hearing in terms of opposition on this?
I don't know. I don't have social media, so I don't follow Facebook. But I mean, there are some oppositions out there. I think administrative, you know, they'd like to see administrators pulled out of the increases to base salary. You know, I hear that. You know, that's something the Board of Education has to, if they want to do that, then they make a recommendation and they get a second and they vote on that. They can pull that out. It's not anything that we could do today.
No, but that.
Without the promise of the 744 board members, you know, I just can't say that that can happen.
Well, and the problem on that is that that's almost smoke and mirrors then, because the money will come out of somewhere else.
Yeah.
Because it's not like we can go 6 years and not have administrators be seeing an increase. But my question, and Dave, a little bit of this is to you, is I think that what I've just seen, I'm not all over this thing, but seeing that in the paper and things, $4.34 or whatever, that number, something right in that number range. I think what we're trying to say is this is a no increase. This is 61 cents we're already paying. We're not voting on $4.34. We're voting on 61 cents that we're already paying. You know, and we no increase. Are we getting that message out good enough?
Well, it'll be on all the campaign literature.
Okay.
And then teachers are well aware of it. And every article and every news story that I've seen, teachers explain it very well.
Okay, good.
And they also understand the necessity of the 61 cent levy passing. Again, it's on the campaign literature. It's a no tax increase. It's 61 cents. It's got a 6-year sunset. It's going to take us to 2030. And everything's just pretty cut and dry. And you know, my thing is, my whole thought process was, I don't think we should ever put anything on the ballot that at least teachers don't approve of. And you know, every teacher I've talked to is for it, and they understand why. And I think we use that message and allow them to tell the community about it, get the word out as much as possible. You know, I'm a board member, but I want it to pass. It doesn't affect me financially. So I think we need to have the people that it affects talk about it the most, and that's what's been happening as of late, most recently. So if you read any newspaper articles, I think they're interviewing teachers more. That makes the most sense to me.
If we're expecting, we've talked a lot about a decrease in attendance or enrollment. So when we built in 6 to 9 additional members each year, if we have a decrease in enrollment, why do we need an increase in staff?
You would still take a decrease. Your staff would still be taken care of from a nutrition standpoint. So we would downsize. And these are just additional places that you would need these people. So it's not necessarily additional staff members in itself. It's additional staff. I know that doesn't make a whole lot of sense,
No,
but so you would so what you would do is just identifying different types of staff members that you need to take care of disciplines, to take care of large class sizes.
And I think the question you're asking is that we're talking about staff has gone down from an ADA standpoint, or students have gone down from ADA. We're looking at the staffing from what we have of students in the building right now, not from what our ADA number has been, which has come down because of COVID, because of attendance, things like that. This is looking at staffing from what are the actual bodies in the building right now.
And we're still short teachers.
We are right now, yes.
Yeah.
And the needs of those teachers, I mean, if there's lots of issues in the classroom, it needs more hands.
Right, split those sports in place, yeah.
It needs more staff, so.
Do you think some of our discipline problem isn't so much hands-on as it is policies not being enforced? Because I know that's an actual problem.
Yeah, I'm not going to say that it's not. I think it's part of it. Do I think it's the only thing? No, but I do think it is something that will be addressed.
And to answer, if you were asking about opposition, I am online a lot, and a lot of the opposition I've noticed, it's mainly a lot of people do not actually understand it's not an increase, or they don't know where the money's going. And so hopefully after today's meeting and everyone's able to look at this, people will understand more and be more likely to be more positive about it.
So I would ask, you share this with whoever you want. You tell them that I'm happy to come and talk to any group. It doesn't make any difference. We'll make it work. Any other questions?
I have one more question.
Yes, ma'am.
Just from going back, do you guys remember the form that we had talked about? This has been a few months ago, where we talked about the 61 cents and what it goes for and how we're going to be in the red if we don't sustain the levy. So I'm just curious, and I'm not against, because I was actually for an increase above 61 cents, but if this was just to help us sustain our budget, how are we able to build in extra things if it's the same 61 cents?
You're not necessarily building in extra,
Yes, it is.
well, because we had built it in 2019, and the previous time the levy, there was other things that were above and beyond that.
But the staff increases.
So you're really just, it's all operational. You're still doing the exact same thing from an operation standpoint.
But it wasn't increasing, and like I said, for the record, I'm not complaining about
No, I
teacher
understand.
salary increase, but I'm saying it's hard for people because they catch little things like this, and it was brought to my attention, I had to look back because I didn't remember, but the words were, if we don't sustain what we have, then we're gonna have to make some cuts. But now we're sustaining what we have with 61 cents, but now we're adding increases. And so it makes it look like it's not, it makes it look like there's a conflict in what we're saying from.
So some of the things that we
Couple
talked
months
about
ago.
added, that last time we put the 61 cents in, we've done, completed the security upgrades, the security.
We're not
camera.
completed with security upgrades. Benton and Lafayette still not finished, is it?
But that's already being taken care of with this 61 cents. That's not gonna be a continuing expense for us. Just like once we did some of those security upgrades, we said part of that 61 cents would go to that, and it did. But moving forward, obviously, those pieces would be, there's some things being moved to other capital projects and stuff that gave here. So it's all about how do we allocate the 61 cents and moving forward. Some of those things have gone off in that they were a capital upgrade at that time.
I think it was the same also as the board voted, I believe it was in March, to add $500 to the base pay. We didn't raise taxes to do it, we just found it in the budget.
Right, I understand.
So, to me, I think it's the same thing.
But when they're asking what kind of things are on social media, I'm just explaining something, and like I said, I had to go back and understand the two, and I had to watch to understand, but I get what the question is, and I had the same question. If we were told that we needed to continue the sunset, so we're not in the red with the current budget that we have, that was the money that was needed, but now we're adding extra things in there. So I think that was the perception, and I get it, like, it doesn't make sense.
Well, you go back to deferring maintenance. You know, you go back to the things that we did for a long, long time in this district. You defer maintenance, and so you get further behind on those maintenance pieces, things like this. Some of the things that, you know, Gabe's listed in your operational costs are so that we don't get back to that point where we're always playing catch up on maintenance, things like that too.
That's okay. I'm good.
I guess my comment on that, Joe, I think that's a really good point. My thought process in that has been, we haven't seen a reduction in state funding that we anticipated. And that the fact that the state funding stayed up has helped us be able to do other things. On the big thing, they did the air conditioning and all that, that's kind of one whole section. But even on the normal funding, it's helped us be able to get funding at this level of operation where we're not at that level of operation. So we can be at fewer teachers now, improve salary, but we're doing that kind of on unreal money, in my opinion.
Because I don't think this even included that 50% increase in fuel that we're spending for the buses. And that way you guys just said that we have an increase in the fuel. So, I mean, there's some of this money that needs to be spent for some of those expenses that we weren't anticipating. I don't think anyone thought our gas was going to be what it is, so.
I think our contract with Apple Bus is already fixed too, isn't it? Like how long, how many years is that? fixed?
3.
So that's already fixed.
We knew it was going to be a 4.3% increase this year, and we know it's going to be a 4.9% increase next year. But on the fuel, no, we didn't, you know, that's just above and beyond. So you're just taking away from something else. So, you know, if we had asphalt work we wanted to do at Lafayette and Limber, we had to back that off because of the fuel prices. We just kind of prioritize, just like the Board of Education's doing with what dollars they have, we have to do that within our CIP projects in the operations department. It's taken away from someplace.
Dave, I just wondered, could you break down, I know we talked about it, how we're gonna spend that approximately $7 million a year. I know teacher salaries, covers all staff and everything, administrators. There was something else in there you mentioned about air conditioning and early childhood possibly, a one-time expense.
No early childhood.
No early childhood, okay. Was there a one-time expense on something besides the air conditioner? So,
Sidewalks.
okay, that was the one you just said, mentioned today, right? So all the levy money will go to staff, teacher, everybody's salary, and nothing's going to the air conditioning?
Yes, it is. It's listed in there.
Okay, but that's the only other thing that's gonna be
Uh-huh.
done by that.
And the sidewalk would be a city expense, wouldn't it? You said
Well,
it was
we're gonna
a
partner
city-
with the city to come up with that. We could probably take care of some of it, Joe, like on our property,
Yeah,
if we could get the permit. I mean, it's not like our property's a lot, but if you go in front of Pershing, we could take, you know, probably from the stoplight all the way down to the next road. That's all ours. So we can go ahead and do that.
Yeah.
So there might be some things we want to go ahead and try to get ahead of the game a little bit, because we have people on staff that can do that. And I think if people in the community understand that that's a priority, that's a big deal. And not all of them are terrible access. Another thing is we're looking into some federal dollar opportunities. I don't know if you guys were around to remember this, but back in, you know, the mid-early 2000s, late 2009, used to be called the Safe Routes to Schools grant that you could fill out that allowed for that type of stuff. We took advantage of it in my previous district, and we put sidewalks in the whole town. So we're looking at avenues with that, working with the city to talk about those types of things. But I think everybody understands that it's a high priority.
Yeah.
It needs to be done, period. We need to stop talking about it.
Glad we're finally addressing it.
Any other questions? Larry, did you have anything that you wanted to add?
Well, I think our handouts are, that Bruce Johnson passed around, I think they're pretty much self-explanatory. There's one in there that compares your total levy with all the schools that are 10,000 or more enrollment. And then there's one that compares the levy with other schools in northwestern part of Missouri. There's the election results handout, the 61-cent levy that passed in November of Proposition 2, that was November of 2019, or April of 2019 rather. That's the levy you have, and it passed, and you can see what the vote count was. It was 64% majority, and you see the different precincts where the votes came from. It's probably going to be, because it's a primary, there might be a higher turnout in August than there was here, but this is just to give you data to help formulate your strategies. One strategy, one idea I have, and maybe it's already underway, is to have a DVD that can be on social media where it's the whole proposition is explained, and people can look at it, and it might offset any negative comments that are coming from that direction.
You know, what are those typically made by your committees or?
They're typically made, there's a firm that does it, but sometimes the schools do their own internal with their
Communications department?
communications department.
Can you send me some examples of those?
Yes.
Okay.
And I could draft a script
Uh-huh.
that might do the job. It could be 8 to 10 minutes long, and cover all of it. Try to emphasize that it's not a tax increase, it's to keep us where we're at, those type of comments that are coming forth.
Right.
Because in the summertime, it's difficult to assemble people for meetings to learn this, but social media seems to be very effective.
But I don't think it's keeping us where we're at. That's what I was just asking. It's actually giving teachers an increase. So I think that if we're gonna do that, we need to mention that. That was my very point that people had made, was it's not keeping us where we're at. If we're adding extra things like the teacher's salary. So we need to be careful that we don't conflict our words.
Well, yes, it needs to be accurate, what we write for your comments needs to be accurate.
Is there a cost for you to write that?
It would be run through Dr. Edgar, I'm sorry.
Is there a cost for you to write that? Because I think.
No.
Okay, good. Because I thought Mr. Foster's pretty, I think he would be good to write that. And I even made a comment, I think Mr. Foster and Edgar should make a video and put it on social media so it comes directly from the leadership with some of these presentation points.
And that's fine.
Yeah.
Yeah.
And back to your point, Joe, one thing that, it does show an increase, and I totally understand where you're coming from, and I get it, there's always gonna be contradictions, but we did give a $500 increase in 19, we did give a $500 increase in 20, we did give a $500 increase in 21, we did give one in 22, we plan to give one in 23. So, was it built in there? No, but we did it. So strictly from an operational standpoint, in order to continue that, that's why it's showing you there's an increase. It's not, and I was just trying to be transparent to put it on there. I could have just added those numbers together and then showed it that way and not use the word increase. But I want people to understand that this is what it is.
I would still argue that it's not an increase because the 61 cents is what we got coming in. It keeps us at.
The revenue is the same.
Yeah.
Yeah.
They're just using the revenue in a different way. It's the same.
How we choose to use it is up to, if we're going to increase salary or not, it's up to us.
Yeah, it's not a negative. I've repeatedly
No, I
said I don't think it's a negative. I don't want
I
anyone.
agree.
I don't need the watchdoggers, if you're watching, to come after me.
No, I get it.
So I'll say that.
Okay, well, if there's no other questions, I'll entertain a motion to adjourn.
So moved.
Second? All in favor, aye.
Aye.
Thank you, guys, I appreciate it.